Well, oncoplastic surgery, as the name suggests, is a very specialized type of surgery that is a combination between two major disciplines. One is oncologic surgery. Onco stands for cancer, so that's a breast cancer resection surgery, and plastic surgery, which is cosmetic. So an oncoplastic surgery is this fine balance between safe resection of breast cancer and no compromise to the good cosmetic appearance. Yes. So oncoplastic surgery, as we mentioned, is based on two main pillars. One is safe resection of breast cancer, and two is good, acceptable cosmetic outcome. To achieve these two goals, there are different techniques that we as oncoplastic surgeons employ. The two major types are volume replacement or volume displacement. The volume displacement technique, which is basically consists of reshaping the breast, and it is heavily based on the breast reduction and breast lift plastic surgery techniques. The volume replacement is when the resected cancer volume is too large that we cannot account for that by reshaping the breast. We need to bring volume from somewhere else, and this it will be in the form of a flap from a different part of the body, and this includes chest wall perforator flaps as the example of this type of oncoplastic surgery. Oncoplastic breast surgery main concern is safe resection of breast cancer. So what happens in the first visit is a standard assessment for any breast symptom, whether this is a breast lump or nipple discharge or skin changes or breast pain. All these symptoms are assessed in the standard way, which consists of the triple assessment, and this involves a clinical examination by the surgeon, followed by the appropriate imaging, and if necessary, tissue diagnosis in the form of biopsy. So this is what we expect on the first visit. And if there is a diagnosis of cancer that will need surgery, then on the following visit, we plan together what is the best approach to resect that cancer safely, also without compromising the shape, the functional, and the cosmetic outcome. I would like to emphasize that oncoplastic surgery is a type of breast conserving surgery. It's a way of doing a lumpectomy that uses or employs their plastic surgery techniques so that it doesn't compromise the shape. So any breast conserving surgery should be followed as a standard by radiotherapy. And this what will inevitably follow oncoplastic surgery. There is always a chance for tumors to come back, whether the patient had a lumpectomy and radiotherapy, or mastectomy, or a lumpectomy done in a special way as an oncoplastic surgery. In order to minimize that risk of the tumor to come back, we use different methods for adjuvant treatment for cancer, such as radiotherapy, hormone treatment, if this is appropriate for an estrogen-sensitive tumor, or chemotherapy if this is indicated. So the goal of oncoplastic breast surgery is to achieve this fine balance between safe cancer resection, so get rid of the cancer totally in a safe way with good, healthy safety margins, and the good cosmetic outcome, so without compromising the shape or the function of the breast, which is a very important aspect of the body image. For a lot of our patients, having a large lumpectomy might cause disturbance of the shape of the function, and oncoplastic surgery aims to avoid that. And the main success of oncoplastic breast surgery is that it allowed us as breast surgeons to achieve larger resection volumes without having to do a mastectomy. So it's mainly avoiding the mastectomy with all what it comes with in terms of body image and all the psychological impact, but at the same time keeping a reasonably acceptable shaped breast within the plastic surgery techniques that we employ.